Good afternoon.
My name is Barbara Barney-Knox. We're going to talk a little bit about the LVN to RN Apprenticeship Program, which is a program that CCHCS developed in partnership with SEIU, which is a local union. Excuse me. So let's talk about where we are or where we started. In the correctional healthcare facility, we had a PT track, which is a psychiatric technician. They could promote in the ladder to a senior PT or a unit supervisor. We also have our RN classification. They can promote up through the supervising registered nurse or a director of nurses or a chief nurse exec like myself. The LVN classification is a classification that came into existence in about 2006 for corrections. Unfortunately, at that time, we failed to develop a promotional track for them. So from 1975 to about 2006, corrections used what we call an MTA, a medical technical assistant who was basically a correctional officer with a license as an LVN or an RN. So for the healthcare professionals in the room who are cringing, you have a right to cringe because, as we know, that's a little bit of a conflict. I'm going to provide your care, but I'm also going to lock you up, turn around, let me put the handcuffs on you, and give you a RVR for something that you did bad, but maybe related to healthcare. So what did we do? We partnered with the Division of Apprenticeship Standards. Earlier you heard Juanita mention about the apprenticeship grants that are out there, but you have to partner with a college. We did that. We partnered with San Joaquin Delta College and the California Community Chancellor's Office, as well as the BRN. The Board of Registered Nurses was a huge supporter in this program, and they've supported us throughout the last 2 years. Excuse me just a minute.
So, we're going really fast here.
Because we only have 15 minutes. Is this your slide or my slide?
This is my slide.
Okay.
So we actually talk over each other all the time, and we're trying to do that. We're not trying not to do that really well. So here's what we know about our LVNs and our RNs in our workforce. And in general, I think you can apply this to a variety of our professional nursing in the institutions that they work in. Women in America are still 35% more likely than men to be poor. And currently, 35% of single women with children live and raise their families in poverty. There is a racial wage gap where minorities earn considerably less than their white counterparts. Nurse executives believe only 10% of newly graduated nurses were fully prepared to practice and practice safely and effectively. Now, baby boomers like myself will leave a shortfall of about 260,000 nurses by the year 2025. That's a huge gap that we have to fill. All of these are gaps that we have to think about. And when we think about corrections, we think, well, who wants to work there, right? Very few of our colleges or schools of higher learning have any programs that target correctional health care at all. So in our energetic little selves, we've really pledged, because we want our correctional health care in California to be an employer of choice. It is a goal for our organization. And I think that starts a transformation that we haven't really thought about before from a correctional standpoint. We know that job satisfaction has been linked to better attendance, a decrease in a turnover rate of new employees, and an increase in productivity. And we also are hoping for an additional benefit of better patient outcomes as well. When we queried our recent graduates who are now working as registered nurses, 80% agreed that the confidence in work has increased. And another 80% agreed that, strongly agreed that they are a bigger part of the healthcare community, understanding their role with patient care. So we are thrilled to be able to offer that, both for our patients and the community and our nurses.
So just a little bit of a data. This program was supported heavily by our governor, Jerry Brown. He funneled a lot of apprenticeship funds into California. We also had additional support from different senators and assemblymen around this program. We do want to make a difference and with our employees, but it's important that you understand we're not a 2020 program. And I'm not sure how many people in the room are familiar with the 2020 program. Is there anyone here? So in California, we have 2020 programs where an employer will pay an employee up to 20 hours to go to school. But that's all they do. The employee has to go out and get everything ready for themselves and manage it. And this program, we will pay them 20 hours to go to school, but we also provide for them a success coordinator that's hired by the union, a director that's hired by the college, and then we have a joint apprenticeship committee that I co-chair along with other members from CCHCS, Delta College, the Apprenticeship Standard Board. And between this entire group, we are supporting the students around every aspect. Childcare, do you have a ride to work? You need remediation because you didn't pass the class. So it's very different than just a basic 2020 program. So what are the goals of the program? We want to make sure that our graduates are eligible and can sit for the NCLEX and that they pass. Not only that they pass, but they pass at the same rate that other college students are passing. We also want to give them a solid foundation so that they can provide competent care once they become an RN. We want them to function legally and ethically within the boundaries. For our community partners, we want to support the underrepresented demographic to attain a higher financial stability. So what are we talking about there? Most of our graduates, 90% were women. 90% in the program were women. Also, about 70 or 80% are minorities. So we want to support that group. We want to create a new paradigm for earn and learn. We don't want to just tell the employee, go to school. We want to give them support to go to school. We want to remove barriers. We want to make sure, like in our environment, overtime is an issue. We don't want our employees working overtime and then they can't get to class the next morning. So we're partnering with the individual chief nurse execs at the institution to ensure these students are given the right time to go to school. We also want to meet the workforce demand. So we want to reduce the cost of new hires in corrections. And we think by using our existing employees, we can do that. We want to develop our RN workforce from our existing employees and we want to reduce turnover rate, vacancy rate, reduce the recruiting cost, and really become an employer of choice, as Jane has mentioned. I read one of Jane's side. I'm going to let her read one of mine.
Take a look at this nurse. This was one of our graduates, and I love what she says. I'm shaking in my skin because I'm so excited. And I love that she's wearing a nursing cap. I happen to have mine somewhere from the dark ages. It's petrified by now, but it's still something that I have to say just causes people to take notice. Everyone recognizes that. This young woman is a single Mexican-American, first-generation college graduate, second-generation immigrant. She started working on nursing prerequisite courses in 2008. She spent 7 years taking classes here and there and was our first graduate in the program. We are very proud of her. She is highly motivated and appreciative of the opportunity, and without the program was unsure if she would have ever completed her degree. She's currently started working on her bachelor's for nursing. Her compensation and benefits will double from about $6,400 a month to $12,900, about that. I have to give you just sort of general numbers. That is a really big deal in the state of California, where it is a very expensive place to live. It's wonderful, but it's a little expensive.
Our second graduate in the first cohort was Juanita Esquer. She's also in the first class, and she says, I've always dreamed of getting my nursing degree while I work. This is going to be life-changing because I can better provide for my family. She's also a first-generation immigrant, first person to go to college in her family. She has kids, and she was really excited for this opportunity and didn't believe that she would ever finish her nursing degree anytime soon. So when I talk about the first cohort, we had 4 different cohorts that we partnered with San Joaquin Delta College, and we are currently in our last cohort. We have since developed another apprenticeship program with Sacramento City College, and that program will also focus on allied health. So we are trying to really create a vision. Jane had a vision that we would have a pipeline of not just RNs, but also MAs and CNAs and LVNs. In the correctional setting, a lot of the care is provided by CNAs and MAs. And I think, as we heard earlier today, that is a trend. And when you talk about moving toward an ambulatory care setting, that's where most of our care is provided.
So now the big question for agencies and employers and higher education is finding the value, being able to articulate what the value is for your agency and, most importantly, for your patient. And so we want you to think about that. We want to think about some of the things that are value added in this program. And can we make it cost effective was a real big thing for us. Can we continue the apprenticeship program and expand it statewide, given all of the various constraints with state agency, community resources, county, and federal, that all play a big important part in our big initiative here. And what are the costs, right? What are the costs? How are you going to leverage that when you ask your senators for additional funding for our program? And what population is this going to serve in the future? Barbara talked a little bit about, can we build an articulated program starting from that, certified nurse assistant all the way through to master's prepared and beyond. We have students who are participating right now and getting their doctorate, and we're so proud of all of that. But we need to build these bridges all the way across. And not all counties and locations are equal when we're talking about a big state like California and the prison system. Prisons are oftentimes located in areas of need, right? Mm-hmm. They're developed and built there because it offers employment. But it's really hard to attract nurses and providers and other staff. So we see a big opportunity for programs like this to help us build that. So think also about some of the challenges we might be facing. We've heard fabulous conversation today and presentations, of which I am so grateful. And we really want to hear from you your best practices or watch out in our after presentation discussion. So looking forward to that.
So some of the employer challenges, we have to backfill behind the staff. Right now we are at 500,000
about that
to backfill behind the group that we've put through in the last 2 years. And what's the cost of the return on our investment for that? How do we quantify that? Also, there's additional workload in just managing the program. Do you have the buy-in and the support of the institutional leaders? We work at headquarters, we oversee this program, but the impact is really happening out at the prison. And how do you manage the apprentice, stay neutral, not as an employer, but as a supporter of the Joint Apprenticeship Committee? And then there's program challenges, meeting an obligation of a 2-year commitment, asking that they stay with us. This is a non-traditional apprenticeship program, so there's laws and regulations and the BRN that we have to abide by. And then some student challenges. A lot of the students, English is a second language. They haven't been to school in a decade or more. Studying and going to school is a challenge. There's a lot of remediation that happens. And we worry that they're not going to be able to pass a class or even the NCLEX. So we have to provide that support. So as leaders, our time is up. So how would you as a leader in the healthcare industry package this program for success? And we will look forward to any feedback that you might have. This is our second cohort. That's me there in the yellow. I just realized that's not a good color for me. I look much better in red.
Oh, you look good in anything.
But thank you so much.